Hey, welcome to The Explainer. Today we're diving into something you might not think about a lot, but it is absolutely vital: cardiopulmonary physical therapy. It's this specialized field that works kind of behind the scenes, but it is so critical for patients who are trying to recover from major surgery or a really serious illness.
So let me start by asking you a question. When someone's in the hospital, fighting their way back to health after something big, what do you think is the single most fundamental thing they have to do to even begin that recovery process? The answer? It might not be what you think.
It's learning how to breathe properly again. I know, it sounds so basic, right? But it's not. And that is exactly where the hero of our story comes in: the cardiopulmonary physical therapist. They are the experts who help restart the body's most essential engine. To really get what these therapists do, let's walk through a real-world scenario. Every good story starts with a problem, and for the patient we're about to meet, the problem kicks in right after surgery. So here's the situation. Picture this. Our patient just got out of a major operation. They're in a lot of pain, and because it hurts so much, they're taking these tiny, shallow breaths. Well, that leads to a really common complication called atelectasis. Basically, parts of the lung aren't inflating the way they should, and they can even partially collapse. This is a huge setback, and it's exactly what our therapist is there to fix. So, what's the first thing the therapist does? Well, they become a kind of medical detective. They don't just jump in and start treatment. No, they start by gathering clues, piece by piece, to build a complete picture of what's going on with the patient. And this investigation isn't random. It follows a really clear three-step process. First, they do a deep dive into the patient's chart to understand their history and the surgery they just had. Second, they sit down and talk to the patient to hear their story directly. And third, a hands-on physical exam to see what the body itself is telling them. And this really highlights the human side of all this. That interview isn't just about ticking boxes on a checklist, it's about building a real, comfortable connection. Because it's in that space of trust that a therapist can really find out the most important stuff about a patient's pain, their fears, and what they hope to achieve. The physical exam? This is where the detective work gets really hands-on. The therapist starts to uncover the next layer of clues. They see the patient's posture is guarded, a dead giveaway for pain. They can spot the signs of respiratory distress. And when they listen to the lungs with a stethoscope, they hear those diminished breath sounds. That's a classic sign of the atelectasis we were just talking about. The case is building.
Okay, so with those initial clues gathered, now the therapist has to look even deeper. They need to use specific tools to read the body's internal signals, especially the ones coming directly from the heart.
And to do that, you have to understand the heart's own electrical system. The easiest way to think about it is like a tiny, perfectly timed spark. It starts in the heart's natural pacemaker, the SA node, spreads across the top chambers, takes a split-second pause, and then zaps the bottom chambers, telling them to pump. It's this precise, incredible rhythm that keeps us alive.
So the tool they use to watch this whole sequence in action is the electrocardiogram, or, as we all know it, the EKG. It's basically a visual printout of that electrical current moving through the heart. For a physical therapist, the EKG is so important because it shows them exactly how the heart is handling the stress of recovery and, down the line, exercise.
And here is exactly what they're looking for. On the left, you see a healthy, normal EKG. See that nice, predictable, repeating pattern? Now look to the right. See that little dip? That's an abnormality called ST segment depression. And that is a huge red flag. It can be a sign that the heart muscle isn't getting enough oxygen. Therapists are trained to spot these tiny signals to make sure every single step of the recovery is not just effective, but 100% safe.
All right, the detective work is done. All the clues, from the chart, from the patient interview, the physical exam, the EKG, it's all on the table. Now it's time to build a plan of attack.
And this gets right to the heart of the matter. The therapist faces this critical choice. Leaving the patient in bed, immobile, might seem like the safe option, but the risks are staggering. You're talking muscle loss, decreased blood volume, a much higher risk of more complications. On the other hand, mobilization, just getting the patient moving, has incredible benefits. It improves everything from heart function to muscle strength. The key takeaway is this: movement isn't just part of recovery. For so many patients, movement is the recovery.
So what does this treatment plan actually look like in practice? Well, it's a multi-pronged attack. You've got breathing exercises designed to literally re-inflate the lungs. You've got that early and progressive mobilization we just talked about. even things like strategic positioning of the patient in bed to help their lungs work better, and techniques to help clear out their airways.
And the why behind all these actions is crystal clear. The therapist is working to directly reverse that lung collapse, to stop any other complications from sitting in, and ultimately, to get the patient on the road to their best possible function and wellness.
But the job is not done once the immediate danger has passed. Not even close. Those in-hospital treatments are really just the first step. A massive part of cardiopulmonary PT is all about setting the patient up for long-term success, long after they've left the hospital.
And to do that, therapists often use a really smart framework. It basically shows that if you want your teaching to actually stick, you have to address 3 different areas. First, what they call predisposing factors. What does the patient already believe and know? Second, enabling factors. Do they have the skills and the resources they need to make a change? And finally, reinforcing factors. Is there a support system there to cheer them on?
But when you boil it all down, it comes back to this one powerful idea: building the patient's self-efficacy. It's a bit of a psychological term, but all it means is a person's belief in their own ability to succeed. The therapist's ultimate goal is to empower that patient, to give them not just the tools, but the deep-down confidence to take control of their own health for good.
So when you see the whole picture, you realize recovery is so much more than just pills and medical procedures. It's about breathing, it's about empowerment, and most fundamentally, it's about movement. It really makes you stop and think, doesn't it? What does this all teach us about the incredible, and maybe often underestimated, power of simply getting back on our feet?